One of the things that we've tried to do here at the Cancer Center is to realize that cancer care is a journey, and that it's not a series of isolated events. It's not surgery, it's not chemo, it's not radiation, but all one part of one long continuum that quite frankly starts at the time that that woman either feels a lump or undergoes a mammogram and has a biopsy and has a diagnosis. At that point, they meet with one of our navigators who start to indicate to them what it is that they're about to go through, to help them get from that point where the biopsy is done and a diagnosis of cancer is made to their surgeon, to their medical oncologist, to their radiation oncologist. Not all of those things are necessary, but virtually all women see one or all of those people at some point during their journey. Then if they go on to treatment, there are going to be complications of treatment potentially. There are going to be some potential confusion about how long the treatment is. When are they supposed to show up? These navigators are right there. The patients have their phone numbers available immediately to help get them through this process. And importantly, the process doesn't end when all the treatment is done. Many patients have received medications or radiation for which there may be some long-term consequences. There are survivorship care plans that are given to individuals. We have a survivorship clinic to assist them with some of what those complications may be and to the readjustment to non-cancer life, if you will, to survivorship. We have physical therapy. Many women following breast cancer surgery have limitations in the movement of their arms and shoulders. They need some rehabilitation work. Some women will have some swelling in the arm that requires some physical therapy. All of those things are available, and all those things are considered at the time that the patient goes through the process proactively rather than retroactively and reacting to crisis and difficulties. So all of those things, including, and not the least of which, are financial advisors who help folks who have fairly frequently insurance-related questions about the cost of chemotherapy and treatment, and a psychologist on staff to help with folks who are having some difficulty dealing with the rigors of the treatment and the implications it has for their life, for their job, for any of a variety of things that perhaps those of us who are just giving them treatment are perhaps not always fully thinking of, although we should.